I got 200 units of Botox in my face 2 weeks ago for muscle spasms. That side is now completely paralyzed. My face on that side feels dead, like cement. If I try to move it to chew or talk, it feels tight.
Thank you for your question. You submitted a photo which shows the right side of your face drooping, and you state in your question that you had 200 units of Botox, and now the right side of your face feels, as you stated, dead and apparently is quite paralyzed. So, and the reason you got the Botox was for facial spasm. Well, certainly I can give you some perspective on what my assessment would be in the absence of a physical examination or reviewing your previous doses. Just a little bit of background. I'm a board-certified cosmetic surgeon and a fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. And my experience with Botox ranks as one of the oldest because the original group of doctors using Botox were basically neurologists and ophthalmologists. Coming from an ophthalmology background and then oculoplastic surgery, before Botox Cosmetic even existed, there was Botox for the treatment of strabismus, for the treatment of blepharospasm, and the treatment of hemifacial spasm. Now, Botox originally was really considered like an orphan drug, a drug that was going to have a limited application for very specific neurologic conditions. So I have a lot of experience with those neurologic conditions from 1993 onward. And I would just venture to conjecture that that your condition of muscle spasm is a condition called hemifacial spasm. Essentially, the muscles are contracting out of control in a way that it causes discomfort and affects your functionality. Now, in my experience, whether it's hemifacial spasm or blepharospasm, the doctor who is treating you probably has treated you for a long time, and in many cases, many years. The patients I have, in particular, patients who have blepharospasm, their charts are very thick because they had to come in on a regular basis to have Botox. For example, for both eyes, it's easy to go through 100 units for benign essential blepharospasm. But with conditions like hemifacial spasm, there's a little bit more finesse because you want to try to avoid the situation where you overcorrect. Now, as you well know, Botox is a temporary treatment and that eventually over several months things will get better. But I would advise you to reach out to your doctor as soon as possible. There are things that concern me about your situation. Essentially, when you have relative overcorrection, you're dealing with, for all intents and purposes, a facial nerve palsy. And the things that make me most concerned about a facial nerve palsy is eye exposure. When the nerves are relaxed or paralyzed in a way that you're unable to blink completely, then your eye can be so exposed that you can actually affect the health and the integrity of the eye. So reaching out to your doctor, checking, and maybe seeing an ophthalmologist to make sure that their eye is being protected. You may need to use artificial tears, ointment, and maybe even tape to protect the eye when you sleep. Now, as far as the other levels of functional situation, you are going to face with the same challenges as somebody who has, let's say, Bell's palsy, or who has had a stroke, who's had facial nerve paralysis, has to face, and that does also include oral function. So it gets back to having this question discussed with your doctor. Yes, within a couple of months, the Botox will wear off, but in the meantime, you have to preserve the functionality of the critical areas, and certainly from my perspective, the eye is very, very important in terms of your ability to be able to see moving forward. Exposure of the eye resulting in dryness or loss of integrity of the epithelium of the corneal epithelium, you could even go so far as getting infections and ulceration. So this is something that needs to be addressed sooner rather than later. So meet with your doctor, figure out what happened, and your doctor needs this information in order to be able to plan your treatments in the future. So I hope that was helpful. I wish you the best of luck. Thank you for your question.